Something that was a quite striking feature of surgical interventions that were performed by the Kisii people is that when they would perform these interventions, they would typically leave the operation wound open. And what they would do is they would, on a regular basis, multiple times a week, within the first 2 months of performing the operation, they would pack it with a mixture of herbs that they would source from the local sort of forest and the local environment, and they would do that on a weekly basis, multiple times a week, for the first 2 months. After which, the post-operative care of the wound would then go to the family, and it would be done by the family, but it would still be done under the very, very close supervision of the Ababari themselves. And basically, the reason that they give for doing this is, one, they wanted to avoid necrosis of the wound where that the operation had happened, because they were aware of the dangers of necrosis occurring, because it's likely that that had occurred in the past with certain Ababari that were performing operations. So they wanted to avoid the necrosis of the wound, and it was much easier for them to use the herbs that they knew had healing properties to ensure that the wound healed properly. The Kisii people in Kenya are a very, very interesting case study, because there are quite a few medical interventions that they use to engage in, which, when you analyze their history, is most likely something that they developed on their own, independent of any sort of influence.